sell an immoral and unworkable bill such as NHI to lawmakers and the public, the ANC government relies on a twisted portrayal of the South African healthcare sector. In their view, South African healthcare is strictly split into two halves: the expensive private sector and the affordable but neglected public sector. The private sector is run by greedy businessmen and staffed by affluent doctors, and they exclusively treat rich patients who are members of medical aids. The public sector is run by benevolent government officials and staffed by compassionate healthcare workers who treat all that are not part of the exclusive group of medical aid members. NHI is then offered as a solution to this distorted image of the South African healthcare landscape. The National Health Insurance Bill has been legitimately criticized by many informed role players in the healthcare industry, yet it defiantly continues on its path towards legislation. Why is this the case? At AfriForum, we decided to take a closer look at how diverse the private sector actually is, and found various care providers focusing on the poor, uninsured population. The most prominent of which is Unjani Clinics, a private group consisting of 193 care settings located mostly in rural areas. AfriForum went on a visit to the Unjani Clinic Diepsloot to hear their side of the story.
My name is Noma Kayangwaju. I am born in the Eastern Cape. I went to Port Elizabeth to pursue nursing. It was 1991 when I started at Livingstone Hospital. And I completed my nursing diploma in 1994. I loved working with heart patients. I loved working in emergency rooms. I loved working in, in medical wards. I love working also with, general wards. But there was an urge in me that, I wanted to work with the community. So before I came to Diepsloot, I had to go to the community. I had to do a survey to see if, the community would welcome the clinic, and if also the pricing they would be able to afford. Unjani Clinic Diepsloot is a community healthcare clinic that is taking care of any diseases, including minor ailments. Our healthcare services is a basic amount of 300 Rand. The 300 Rand, it comes with treatment. So it's a consultation and treatment thereof. The typical patients of Unjani Diepsloot are within the community. Most of them, they don't have medical aids, but all of them, they are patients within, the price range that we have set for them. And they don't like to go to the public clinic, even though it's free, because of the long queues that they experience at the clinic. And sometimes in the public clinics, they are turned away because of the number of patients that go there.
My name is Nomfundom. I'm prominent Bungos. And the reason why I came here today, because I know when I go to the public clinic, it will take much longer to receive the service. And maybe you can come with an emergency, you are ill, you can even get more ill or fall sick more on the line while waiting for the service. And sometimes the nurses, they are cheeky. You have to prepare yourself to be shouted. So that is why I prefer coming here.
Everyone is welcome in the public health care, but the problem is it's failing because we need, professional people that can manage the sector professionally, without any corruption, without any favors, without any, anything that will disturb the running of the system. Because right now what we're seeing, there's a lot of corruption, there's a lot of this, there's a lot of that.
Experiencing healthcare delivery, such as it is offered here, makes it clear that any policy move which can hurt the private sector will lead to the opposite of what the NHI promises to bring about, namely, affordable healthcare for all.
Right now, I don't think NHI would work.
AfriForum's opposition to the NHI bill is grounded on the real condition of the South African economy and healthcare sector, and we will continue the fight until this destructive bill is completely erased. Support us in this battle.